And I think there is the sense that something is going on in America which is serious that we're not addressing. So I just want to say to our panelists and all those who are dealing with long COVID, we hear what you're experiencing. We take it seriously. We think we have not, as a Congress, done anywhere near enough, and we hope to turn that around. The estimate is that some 16 million people throughout our country have long COVID. We know that long COVID can include more than 200 symptoms, including serious cognitive impairment and severe cardiovascular and neurological problems that can continue for weeks, months, or even years after initial infection. Sometimes those diseases can be so debilitating that it leads literally to suicide. It's the case in my own state where a young man, previously healthy, committed suicide as a result of all this. Each reinfection can increase the risk of developing it. In other words, if you're under the impression that once you've gotten COVID, you don't need to worry about it ever again, you are mistaken. Let's be clear. The impact of long COVID is not just a health issue, it is an economic one as well. It is estimated that as many as 4 million Americans are out of work due to long COVID. The annual cost of those lost wages alone is around $170 billion a year.
It's a multi-system disorder that can affect nearly every organ system. It affects the brain, it affects the heart, it affects the endocrine system, it affects the immune system, it affects the GI system. It affects people across the lifespan. We have kids with long COVID. We have people who are 100 years old with long COVID. It affects people across the lifespan and across demographic groups. The burden of long COVID, the burden of disease and disability from long COVID, when you measure it, is on par with the burden of cancer and heart disease. Now, you should be asking me now, how do we prevent long COVID? Well, the best way to prevent long COVID is to prevent COVID in the first place. There is actually no long COVID without COVID. We need a sustainable, multi-pronged approach to prevent repeated infections that would be embraced by the public. Now, you should be asking me also, like, how do we treat long COVID? You've heard it before. There are zero approved medication for the treatment of long COVID. So these people have nothing to really lean on for curative treatment, nothing, zero. Zero FDA-approved medications for the treatment of long COVID. This must change. Lesson number one from this whole pandemic, that acute infections can lead to chronic disease, that pandemics disable people. You have an historic opportunity to act. The lives of millions of people here and around the globe, now and in the future, depend on this.